Hello everyone, welcome to QAxon. I am Dr. Ilham Jalil. I'll be teaching you physiology here at QAxon. I'll be discussing the topic on endocrinology. So in this video, you will learn about hormones and their mechanism of action. Under this topic, I'll be covering different types of hormones, different types of receptors and their mechanism of action. Here we go. Hormones are secretory products of the endocrine glands. They are secreted directly into the circulation. They act on the target cells and give a desired response. In general, the hormones are divided into three major classes, namely proteins and polypeptides. The examples for these type of hormones are anterior and posterior pituitary hormones, insulin and glucagon, parathyroid hormone. Then we have the steroids, the examples being cortisol, aldosterone and sex hormones. The third class of hormones are amines. They are derivatives of tyrosine. The examples are thyroid hormones, epinephrine and norepinephrine. Now let's see the mechanism of action of hormones. The hormone first binds to a receptor, then hormone receptor complex is formed. The activated receptor initiates hormonal effects. The hormonal receptors are large proteins and there are about 2000 to 100,000 receptors in each target cell. The target tissues containing receptors are affected by the specific hormones. However, the number of receptors do not remain constant. It can either be upregulated or downregulated. What is meant by downregulation? Decrease in the number of active receptor is called downregulation. It will result in decreased responsiveness of the target cells to hormones. It can occur as a result of inactivation of some receptor molecules, inactivation of some intracellular protein signaling molecules, temporary sequestration of the receptor, destruction of the receptors by lysozymes after they are internalized, and finally it can be due to decreased production of the receptors. Upregulation is the increase in the number of hormone receptors. It can be due to the stimulating hormone causing increased formation of the receptors, increased intracellular signaling molecules by the protein manufacturing machinery of the target cell. This upregulation will cause greater availability of the receptor for the hormone. Now let's see the different types of hormones and the location of the receptors. For protein, peptide and catecholamine hormones, the location of the receptors is either in or on the surface of the cell membrane. For steroid hormones, the receptors are located in the cell cytoplasm. For thyroid hormones, the receptors are located in the cell nucleus. Now let's see the different types of receptors and their mechanism of action. Ion channel linked receptors, opening or closing of ion channels. G protein linked hormone receptors, open or close cell membrane ion channels, change the activity of an enzyme in the cytoplasm of the cell. Enzyme linked hormone receptor, some may function directly as enzymes. Some are closely associated with enzymes they activate. Intracellular hormone receptors and activation of genes. Hormone response element is formed which either activates or represses formation of mRNA. Once the hormones bind to the receptor, they activate the second messenger system. Second messengers are intracellular signaling molecules, which respond to the extracellular signaling molecules. Here, in endocrinology, hormones are the first messengers, which trigger the second messenger system. The three types of second messenger system are cyclic AMP second messenger system, cell membrane phospholipid second messenger system, calcium calmodulin second messenger system. These second messenger system trigger physiological changes at the cellular level. Now let's see them one by one. G proteins are guanosine triphosphate binding proteins. They couple the hormone receptor to adenylate cyclase. They have intrinsic GTPase activity. They are used in all the second messenger system. They have three subunits, namely alpha, beta and gamma. They can either be stimulatory or inhibitory.